We can make an impact when we do treat children effectively. For example, their seizures or their GI difficulties. We know that can very positively impact the overall outcome for those children.
When you address the comorbids with autism, you start to see a lot of improvement in different areas.
We kept seeing regression with my son, and when we started addressing his immune deficiency, his GI condition, we started to see the regression stabilize, and we started to see progress with my son.
Doing the proper evaluation in a child with autism, and looking at all the markers for the potential presence of common GI conditions that can cause pain, and treating those conditions as you would do in any other child, I think we have seen over and over again improvement of certain behaviors.
He had his first EEG at 6 months of age, and we just had our last one at 4.5 years old.
EEG stands for electroencephalogram, and it's a measure of ongoing brain electrical activity. Since seizures are a disorder of brain electrical activity, it's the most direct measurement we have of the potential for seizures. Just to give a little bit of detail, the way that it's done is that little metal cups, very small, are temporarily attached by a glue to the child's head in prescribed locations. And then the electrical activity is measured via an amplifier. We do this while the child is awake and asleep, because there can be abnormalities that occur during the sleep state that you don't see while the child, or adult for that matter, is awake.
It helps because I know now what a stim is versus what an absent seizure is, where I thought he was having a seizure, wasn't a seizure, it was part of his autism. So it laid a lot of questions to rest, and now I know for sure how many seizures he's having in a day versus what is just him, a side effect of autism.
IVIG, IV immunoglobulins. He started in March of this year, 2009.
You know what that's for? That's the magic cream. Oh, okay.
Diarrhea is almost gone. His food allergies are almost gone. His seasonal allergies are almost gone. And his overall well-being has improved drastically.
But it's interesting that not very many allergists and immunologists will actually deal with the IVIG, let alone the autism part of it. It makes a lot of sense that some of these patients may have autoimmune diseases that are affecting the brain.
We found out through social stories that you can explain to the child what's going to happen, what they can expect, step by step. Children with autism are literal thinkers, and our son is definitely a literal thinker.
The bowl of vanilla hurts for just a second, then it's fine. It makes me scared when I get my cold, but it doesn't hurt. I think I have a gas when I get my cold.
You're being so brave, Hayden.
Brave boy. I'm trying to know that I can be brave.
You are very brave.
Oh, I know you are brave.
Kids that are on the autistic spectrum, it's best to get them really early. You want to get them engaged and understanding that their words have so much power to them.
What will the queen and king eat for dinner? Turkey. Please, can you help?
Sure. COACHMAN.
They can express their ways other than throwing things around, pulling at things, hurting themselves to get either away from the pain or to get people to acknowledge.
We're going to make a quick story and then we'll move on to our book. Okay. Who are some of the characters?
More therapy early on is going to help them develop those skills a lot quicker and a lot stronger.
Had and lost language 4 times, which has been the biggest struggle for us.
Regressive autism is a tough situation. The one thing no pediatrician likes to see is a child losing developmental skills. It's very dramatic. It's traumatic for the parents, certainly, to actually observe that type of situation. Child losing skills, this is a serious problem. That's what we refer to as staccato regression.
After the 4th language regression, we pushed for my son to receive an AUGCOM. It stands for Alternate and Augmentative Communication Device. It's a computer that he carries around with him, and he's able to communicate with it. You want blue? He was so excited when he got it. He just could see the possibilities that were now in front of him, that he had a way to communicate. Green and yellow. Once we finally got it, when he was age 7, you couldn't help but think, oh, if we'd only had this when he was age 3. Getting the device, it's been helpful to other people who maybe don't understand his gestures the way his family would understand. But it's been wonderful to see how happy he is that, you know, it sort of levels the field for him.
BB is Dylan's service dog, and we got her about 2 years ago. She's from the Harry Angel Foundation, and so they place service dogs with children with autism. They're based out of Sedona, and she's basically a companion dog, so she goes with us wherever we go. So whether we go to the movies or out to dinner or to the beach, everywhere she comes with us. And she also has gone to school with him a few times and really helped. Before we had BB, he had a harder time relating to people and expressing his emotions and his feelings. But once we had her and he had the responsibility of taking care of her, he just fell in love with her. And so he expressed his love to her, and then it kind of carried over to the rest of us as well.
Machine guns. I believe every kid with autism should get a chance at treatment and a chance at a normal life.